Well, we're back. We're talking about what we did over the weekend with the doc here, and you said you ran up the mountain?
Yeah, I'm just trying to train for what's called fast packing out in Washington this weekend. So I just kind of ran up Sandias, kind of came back down.
I just ran up a mountain, like, oh, whatever. Really?
Super slow, super slow.
Okay.
Yeah,
And you fast packs? You put like a big backpack on? And
so we're going to do 45 miles on the Olympic Peninsula Saturday. So we'll kind of...
Hiking?
Kind of run hike. So with a buddy of mine. And,
that sounds intense.
Yeah, no, it's just a fun time in the woods.
Well, you're a doc. I mean, is that a good way to stay in shape, is to do that kind of serious long-term exercise? Or can we just get that kind of exercise by, walking downtown?
Well, for a lot of our guys, we always advocate at least 150 minutes of weight-bearing cardio.
So walking doesn't cut it?
Well, yeah, you can actually walk. For some folks, that'll totally be adequate, as long as you're getting your heart rate up. And for every guy, it's a little bit different. And as your body gets more healthy, and that's what we're talking about, men's health and so forth, that as men become healthier, they can adjust their fitness levels. And I think this week we're talking about prostate cancer awareness.
Right. Well, it is the month for it, right? It's September.
It's September. If you think you might need it, get your prostate checked and screened for cancer.
Well, but not everyone has to. You have to reach kind of a certain age before you want to start looking at it. Like, what's the age?
So if you're less than 40, don't worry about it. The American Urological Association.
I lucked out.
The American Urological Association just kind of came out with some guidelines. Definitely want to be screening guys between the ages of 55 and 69. We know that if for every 1,000 men screened, we can prevent 1 prostate cancer death.
Wow.
With screening.
Those are good numbers, right?
Yeah, because about this year alone, I think almost 250,000 guys will get diagnosed with prostate cancer, and about 27,500 men will die of prostate cancer death this year alone.
Wow. And are most of those folks, if they were screened and caught early, could those deaths have been prevented?
Correct. Most cancers that we catch now for prostate cancer, because that's why we call it screening, we're catching it maybe 5 to 6 years earlier. Are there any symptoms, though? I mean, like, if you... Nowadays, not really. And the reason why is because we really check blood tests. And when we talk about screening, it's really a blood test called a PSA. It's a prostate-specific antigen. And the other thing is a rectal exam. And I'm not sure we're allowed to say that on TV.
Oh, absolutely. No, I mean, we may be a morning show, but we try to be serious and have fun at the same time. We can talk about backpacking and rectal exams.
But all in the same segment.
All in the same segment. It's great. But those are the things that we don't really even want to talk about, and a lot of us get worried. Like, do I even want to know what's going on back there? Well,
that's the thing at MDforMen. We're trying to make things simple, safe, effective. We're trying to help guys overcome those fears, face it, embrace it, and move through it.
Right.
We have to stop that men's mentality, that Neanderthal genetic makeup where, hey, I'm just not going to ignore it. I'm going to ignore it and wait until it's either a problem or it's too late.
Right.
And that's why we call it screening. We're trying to catch things earlier to help prevent those prostate cancer deaths.
Because once something goes bad, it doesn't really get fixed, right?
Well, obviously, with any cancer, we want to catch things early before things have spread. The good news is that with prostate cancer screening, the vast majority of cancers we catch are so early on and so low risk that now there's 3 types of therapies. One is actually active surveillance. The majority of cancers...
Just watch it?
Yeah, with repeat biopsies and monitoring with serial PSA blood tests to kind of keep tabs on it, because the vast majority of prostate cancers are very slow growing.
So you will outlive the cancer in many ways, or
So most men will die with prostate cancer. They will not die of prostate cancer, which is a big thing.
Yeah.
But a lot of guys, it's important that they figure out what's in the black box, especially if... So 55 to 69 is a very important time to have shared decision-making with your primary care doc, but we do advocate screening. If you're less than 55, things we talk about for guys, reasons for guys to get screened are, 1, if you're African-American, if you have a family history of multiple father, uncle, brothers who have prostate cancer, or a family member that's been diagnosed at a very young age. You probably need to get in sooner to get checked. When you're over 69, it's really a discussion with your provider. If it's something that you're worried about, if we think you're going to be living another 10 to 15, 20 years, that may be something we want to be checking.
And just watch it.
Watch it depending on what it is. If it's more aggressive, then you may need a treatment.
And what are some of the more treatment options? You said one of them was just watching it and paying attention to it.
So it's called active surveillance. That's where we follow with blood tests and with the biopsies. There's also radiation and surgery.
And so a lot of that stuff just sounds scary. I mean, is it really that bad, or is it not that horrible?
Well, you know, with the advent of technology, we have ways with radiation to pinpoint certain areas, just so we target just the prostate. With surgery, we have new robotic technologies out there that allow us to do a procedure that guys are in and out and go home the next day, for example.
That's pretty great.
Yeah, compared to the old days.
Yeah, no doubt. With the what can you do for prostate health? Like, you know, I'm nearing those ages myself. I mean, is there something I can start doing now to kind of, you know, lower my risk as I get older?
Well, when we talk about prostate health in general, it's a little separate from prostate cancer awareness. But with prostate health, a lot of it, very simple things, obviously, is bladder health. Because the bladder is a muscle that works by squeezing the urine through the prostate.
Right.
The prostate's like a donut.
Right.
You pee through the donut hole. And a lot of it is actually just good bladder and prostate health, voiding on a regular basis.
Drinking lots of water.
Yeah, well, when we talk about drinking lots of water, we talk about, guys, keeping your urine clear. You know, we all often talk about 8 glasses of water a day, but really, if your urine's clear, it's clear. You don't have to drink that much more.
You're hydrated.
You're
at
hydrated.
That point.
Yeah, but
That's
obviously,
good.
if it's dark, you got to be concerned about dehydration and so forth.
Right, right. Is drinking this much coffee good for me for that?
Well, it's going to definitely make you pee a little bit more frequently.
Right.
But, you know, it's definitely something to kind of keep you perky for morning brew.
Well, we need all the help we can get some days.
Yeah. Well, you know, with biopsies and prostate cancer screening, it's important for guys to know that there are simple, safe, effective, efficient ways to look into it and take care of it. At MDforMen, we've brought everything in-house. So the ultrasound machine, the technology to get it all done is all right there.
Yeah.
And then you come back 5 days later and find out.
I think it's probably the worst if you have to go between multiple doctors and multiple specialists and multiple everything, right?
Exactly. And the biopsies itself, they take about maybe 12 minutes total.
That's not bad.
And we numb everything up, try and make things as comfortable as possible. And I think in the heyday, there's a lot of fear associated with it. But I think guys are getting used to it, right? For colonoscopies, prostate cancer screening, we are now being more proactive. And as a community of men, we need to talk to our brothers and say, hey, look, have you gotten yourself screened?
Right.
I know your dad had prostate cancer. You really need to look into that, man. You got 2
Right.
young kids. You need to be thinking about your health.
And your partner, too. This is a conversation you can have with your
Oh,
partner
it's a
also.
team thing. You know,
right?
often we'll bring, so 5 days after the biopsy, I'll bring folks back. We'll discuss the pathology, but it's not just the guy. It's also his partner. Because often, at that point, when you use the word cancer, his brain goes on the fritz. It becomes total static.
Right.
And he needs her there
Right.
to help understand what's going on.
Right. Cool. Well, we're going to be back in a couple of seconds. Thanks. And we're going to talk about these cool motorcycles over here. You see
Nice.
these things?
I know.
You got to have a healthy prostate to be able to sit on one of those, I think, right?
Yeah. Look at that crotch rocket. That's a nice thing.
Right? They look like a lot of fun. Can't wait to talk to these guys about that and their big rally coming up this weekend
Yeah.
on the Morning Brew with Friends.